Hello and welcome to the N225 SPL training. At the completion of this training session today, you will be able to portray your assigned N225 case proficiently, as well as the case's effect and providing feedback to the student post-encounter. Please be sure to direct your questions about the case to the assigned faculty member if you have any. Let's begin. Kemu Remy is in the emergency room with shortness of breath, a productive cough with rust-colored sputum. They have recently returned from a trip to Guatemala. The SP's opening line will be, "I have been sick ever since I got back." This opening line will be given after the student has introduced themselves to prompt an exchange of communication. The SP's starting position in the encounter will be sitting on the exam table, while having difficulty breathing. The attire for this encounter will be a hospital gown with a hospital ID band. The case has a prop, a tissue with rust-colored sputum. This prop will be provided by the CICSP staff. Now, let's look at a sample Kemu Remy encounter.
Come in.
Good morning.
Good morning.
My name is Helen. I'm a nursing student. Is it okay if I work with you today?
Yes.
Okay. First, may I check your name and date of birth?
Kemu Remy, August 28, 1984.
Okay, thank you so much. So I understand you're here because you're having some difficulty breathing.
Yes.
Okay.
I have been sick since I returned from my trip.
Okay, where did you go?
Guatemala.
Okay, and how long were you there for?
3 weeks.
3 weeks? Okay. And how long have you been sick?
Well, I returned 5 days ago, so it's 5 days by now.
Okay, can you tell me what are some of your symptoms?
I can't breathe and I'm coughing.
Okay. Any other symptoms besides coughing and short of breath? Have you had a fever?
No.
Okay, any chills or rigors?
No chills, no.
Okay. All right. And what were you doing in Guatemala?
I'm a volunteer with Peace Corps.
Oh, okay. Great. Thank you for doing that. So, you were there for 15 days? Okay. Just taking some notes so I don't forget. I'm going to ask you some additional, a few more questions, and then I will do a quick physical exam. Then I will share my information, the information I gather with the provider. Then they'll come in to assess you, okay?
Okay.
How old are you?
40.
Okay. Are you married?
I am.
Do you have any children?
No, I don't.
Okay. And I know you volunteer with the Peace Corps. Do you work outside of that?
No.
Okay. Do you have any diagnosed medical history?
I have asthma.
Asthma, and do you take anything for that?
I do.
What do you take?
Albuterol.
Albuterol, and how often do you use it?
Every day, multiple times per day.
Multiple times a day.
Yeah.
Okay. And do you see someone for the asthma?
I'm a doctor.
Okay, good. And do you have you had a history of having any kind of procedures or surgeries?
No.
Okay. From a social history perspective, do you currently smoke?
Oh, no, I don't.
Have you ever smoked?
No.
Do you drink any alcoholic beverages?
No.
Okay. Any recreational drug use?
No.
Have you been hospitalized for any reasons?
No.
Okay. Any family history of illnesses?
No, I don't think so.
Okay. Your parents, are they both living?
Yes.
Okay. Great. Do you have any siblings?
I don't.
Okay. Let me double check this. From a lifestyle perspective, how would you describe your diet?
I try to eat healthy, and be, yeah.
Okay. And do you do any physical exercise?
I ran a marathon recently.
Okay, so you're a runner. Okay. Did you do this before you left for Guatemala? Okay, great. All right. Besides the albuterol, do you take any other medications?
Claritin.
Claritin? And what do you take that for?
The allergies.
Allergies, and what are you allergic to?
Ragweed and pollen.
Okay, great. All right. Okay, I think I covered the essentials what I need right now. I know I can see that you're not feeling well.
Yes.
With the cough, are you coughing up anything?
Yes, I cough this and that. Is this
Okay.
a symptom of possible that is called the tuberculosis or what?
It's hard to say. We need to do more tests before we can determine what's happening. The key things are you're here, and that we will be able to help you, okay? I just need to take a quick listen to your lungs, and then we'll get the provider will come in to assess you too.
Okay.
Okay, I just have you set up for me as nicely as possible. Take a deep breath in and out for me. Again. Okay. Okay, looks like you're having more trouble breathing. I'm actually going to go out and get the provider, all right?
Okay.
Okay. Are you okay? I'll be right back.
Okay.
Key points of the Kemu Remy case. Be prepared for the students to listen to your lungs. Dress accordingly per the SP handbook. Appear to be short of breath. Be sure not to hyperventilate. This will prompt the student to call for a provider before the case leads the student to this conclusion. Be sure you have your case prop, the sputum tissue. Review written case details sent to you prior to the training and event date. At the end of the encounter, the students will leave the exam room, then return for feedback. Take this time to de-roll from the encounter. Please keep in mind that due to time constraints, the students may not leave the exam room. In these cases, an SP can ask the students for 5 to 10 seconds to de-roll before providing feedback, if necessary. Remember the basic assumption when providing feedback to the students. We believe that everyone participating in activities is intelligent, capable, cares about doing their best, and wants to improve. When providing feedback to students, your questions will be open-ended and relevant to the past encounter. Here are some examples of questions for the students. What was it like for you in this past encounter? How did that encounter go for you? How did it feel caring for patient's name in this situation? What were your first impressions of how that went? Here's a review of key points of the N225 cases. Review the written case material that is sent prior to this training. The training materials are sent at least 24 hours prior to the training. Once the materials are sent, it is the SP's responsibility to prepare for both the training session and event. Your attire for the event will be a gown. The students will need to access vital areas of the SP to complete their objectives. The feedback SPs provide to students will be open-ended, relevant to the case and with the goal of helping the student to improve. If you have questions about the cases, the event, or are having an issue, please do not hesitate to reach out to the CICSP staff via email at cicsppcnhp@drexel.edu or call us at 215-783-0277. You can also reach out to the N225 faculty with questions about the case. Thank you for watching.